Hello, everyone, and thank you for joining us for our webinar today, Leveraging Local School Wellness Policies to Support the Whole Child. My name is Jordan Buckley, Manager of School Health Programs at the Society for Public Health Education, or SOPHE. On behalf of SOPHE, we are excited with the interest in today's webinar and thankful that you have taken time today to participate. Before I hand it over to our speakers today, I'd like to cover some housekeeping items. First, please know that all attendees are muted for the duration of today's webinar. To interact with the speakers, please use the chat box or submit to the Q&A. After hearing from our presenters, we will have a question and answer session with the time remaining. Questions can be submitted at any time during the webinar by typing in the Q&A box. We value your feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. Please know that today's webinar is being recorded and will be made available on demand in SOPHE's School Health playlist within 2 weeks. You can subscribe to the School Health playlist on YouTube. As a quick introduction, SOPHE is a nonprofit organization founded in 1950, dedicated to providing global leadership to the profession of health education and health promotion, and to promote the health of all people. Now, I'm excited to introduce our speakers today. We have Dr. Ashley Krause, an educator with a passion. She is in her 25th year as a leader-learner who actively pursues opportunities for professional growth. Dr. Krause has been a classroom teacher, secondary assistant principal, director of special services, and is currently the associate superintendent for the Farmington R7 School District in Missouri. We also have Caitlin Merlot, a health scientist, and she serves as the School Health Branch's lead for school nutrition. She develops science-based guidance and provides content expertise and technical assistance on strategies to improve the school nutrition environment and support healthy eating among youth. Caitlin, I'll hand it over to you.
Great. Thank you so much, Jordan. I really appreciate the opportunity to be on the call today and want to welcome you all this afternoon. Today I'll be sharing a brief overview about local school wellness policies, and then I'm going to turn it over to Ashley, who will talk about how they've worked to align their district wellness policy with the whole school, whole community, whole child framework, and how that work has helped them to pivot during school closures because of the COVID-19 pandemic. So first, I want to share just a little bit of background information about local school wellness policies. Local school wellness policies are a written document, and it outlines a school district's efforts around nutrition and physical activity. The wellness policies were first required in the Child Nutrition and WIC Reauthorization Act of 2004, and then the requirements were updated and reauthorized in the Healthy Hunger-Free Kids Act of 2010. All school districts that participate in a USDA child nutrition program, including the National School Lunch Program and the School Breakfast Program, are required to have a local school wellness policy. And while USDA has outlined the minimum requirements of the wellness policy, the intention is that each district will develop a policy that really reflects the needs of the students and schools in that district, so really personalize the policy. So one way to think about a wellness policy is it's a roadmap for health and wellness for the district. So I mentioned that USDA has provided the minimum requirements for the wellness policy, and those are shown on the slide. The wellness policy must include standards for school meals that meet or exceed the federal requirements for the meal programs. The policy must also include nutrition standards for all foods and beverages that are sold during the school day that meet or exceed the Smart Snacks in School nutrition standards. And then the policy must also have goals for nutrition education and promotion, as well as physical activity. But each district gets to choose what those specific goals are. The policy must also describe the nutrition standards for other foods and beverages that are available during the school day. So foods that are available through school events or classroom parties, or that may be used as a reward for students. And then this is new in the Healthy Hunger Free Kids Act of 2010 language, but the policies must also include language about food and beverage marketing, so that the policy says that only foods and beverages that meet or exceed Smart Snacks standards can be marketed or advertised in the school. Districts must also allow the public to be involved in the wellness policy process, including the development and updating of the policy. And lastly, there's a requirement that at least once every 3 years, districts complete an assessment of the policy, including compliance with the wellness policy, how the wellness policy compares to model wellness policies, and progress made in attaining the goals of the wellness policy. So I did want to mention that related to the triennial assessment, or that assessment that's done once every 3 years, in light of the COVID-19 pandemic, USDA did release a nationwide waiver for districts so that the first triennial assessment, which was supposed to be submitted at the end of June of this year, is now being pushed back and will be due June 30th of 2021. States that want to opt in and use this waiver must let their USDA FNS regional office know that they intend to use this waiver, and then districts in those states that are allowing the waiver must let their state agency know that they will be using the waiver as well. So wellness policies are one tool to help districts address the health and wellness of students and staff. The Whole School, Whole Community, Whole Child Framework, or WISC, is another tool for addressing health and wellness. The WISC framework shows the interconnected relationship between health and learning. The foundation of this model is that in order for students to learn effectively, they need to have their basic needs met. And those needs are that they are safe, that they are engaged, that they feel supported, challenged, and that they are healthy. And this can be achieved by addressing policies and practices across the 10 domains shown in blue. So you can see that the physical education and physical activity, as well as the nutrition, environment, and services, are a part of the WISC framework, and that aligns really nicely with the required components of local school wellness policies. But there are many other factors included in WISC that impact students' health and ability to learn. These include access to health services, counseling, psychological and social services, the social and emotional climate, the physical environment of the school, school employee wellness, family engagement, and community involvement, as well as health education. So you can see that WISC is really very comprehensive. In a minute, I'll be turning it over to Ashley to share how her district has embraced this comprehensive approach to health and wellness and really embedded it in their local school wellness policy so that there's a district-wide plan for implementing WISC. But first, I did want to share a few tools and resources that I thought would be helpful in your wellness policy work. The first is the WellSat 3.0, and this is a tool for assessing the strength and comprehensiveness of a wellness policy. So users can create an online account and then answer a series of questions to score the language of the wellness policy. The tool then provides 2 scores, one score for the strength of the policy language and one score for the comprehensiveness of the content that is included in the policy. And the tool also provides suggestions for how to improve the wellness policy. I didn't put it on the slide, but if you do a search for WellSat WISC, you will also find a new tool developed by researchers at UConn that assesses policies that align with all 10 WISC components. So that's a really nice resource if you're thinking about incorporating WISC into your wellness policy. The USDA Food and Nutrition Service also has some excellent resources for wellness policies, including a summary of the requirements for wellness policies and a communication toolkit that districts can use to get the word out about wellness policies and how different stakeholders can get involved. CDC also has tools and resources, including the School Health Index, and this is a tool that schools can use to assess how well health policies and practices are being implemented at the school building level. Results from the School Health Index can then be used to inform updates and revisions to a district wellness policy. We've also published a collection of success stories that highlight districts and schools from across the United States that have been successful in implementing their wellness policy. And lastly, I'd like to mention the Alliance for a Healthier Generation, who has numerous resources for helping schools understand wellness policy requirements, how to develop a strong policy, including a sample model wellness policy, how to implement a wellness policy, and how to monitor progress with wellness policy implementation. So now I'd like to turn it over to Ashley Krause to share more about her work with wellness policies in the Farmington R7 School District in Missouri.
Thank you so much, Caitlin. So I'm going to start off and talk to you about the realities within our district and try to take some of those resources that might seem a little scary to some people when they're first starting off or when you're looking at a revision of perhaps your health and wellness policy, and kind of put it into practical terms. We're not perfect, and we admit we're not perfect, but we certainly do try to use the tools that are given to us to move forward as a district to wrap around the whole child. So the very first thing that we began to do was to make sure that we recognized we had problems. And as you see on this slide, it says, Houston, we have a problem. We admitted that we had issues within our district and that we needed to radically make some changes. So with that being said, we decided that utilizing the WISC model would be the best approach for us. We recognized that we worked in singleton silos and that was absolutely not conducive to wrapping around the whole child, and we needed to become a team. With that, we said, who needs to be on that team? The very first thing that we did was to, hold on, I'm going to go back here too. So Farmington, let me give you a little bit of knowledge about Farmington. We have 8 campuses. We have 4,000 students. We are considered rural. We have 52% free and reduced population. Knowing that our need to improve our health and wellness, we knew that we were going to have to do a lot of groundwork and that we were going to have a team of people that we had internally to be able to do that. We tapped into our physical education and health teachers, our counselors. We tapped into our school resource officers. We looked at our social workers. We talked to our school liaisons. We looked toward our director of safety. And of course, we included our school nurses. So again, we just looked at what we currently had within our district and what we could continue to utilize. Once we recognized that we had an internal team, we actually began to storm a norm and to begin looking at coming together cohesively as a team. We had a retreat. We came together. We went off-site. We decided that we would start to look at health and wellness as a group event. We decided that we needed to bond as a unit, and we decided that we would have non-threatening talk, which within our district we considered kitchen table talk time. And our kitchen table talk time means that we are going to sit with one another at that kitchen table, and we are going to make sure that we have everyone at that table having very candid conversations with one another, again, in a completely non-threatening manner. We created a hub to communicate with one another, which we're a Google school. So we tapped into our Google Classrooms to make sure that we could hub all of our information together. We defined our roles, responsibilities, and we determined action plans as a unit. So after we formed our team, we started to look at our purpose. one of the very first things that we do as a district each year is determine our why. We talk about our why. We want to know what our purpose is. We want to make sure that when we are having discussions with staff members, we know why we are where we are. We know why we're doing what we're doing. And that means that you have to go to every individual staff member and you have to ask them, what is their why? What is your purpose? We found that our why, when we were looking at the health needs of our students, was going to be that WISC model. So we did begin to look at that WISC 10-component model and to see what key stakeholders needed to be there to fulfill the areas. We also knew we were going to need to balance internal and external members. Here's a list of our key members. So our Health and Wellness Policy Committee meetings, I think in the very beginning when I first took over 2 years ago, they were super small. And I think that you reached out to those key agencies and you would ask them, hey, will you come and join us, your doctors within your community, your clinicians within your community. We decided to go a different route. We decided to pull out the WISC model and look at the components and look at the internal and external community members that could fulfill roles within that WISC model. So when we formed our teams, we looked for variety. We found representatives that had a passion for their forte. So when you looked at social emotional pieces, we knew we were going to have to go to behavioral health specialists. When we were looking at the medical field or the health component, we knew we were going to have to reach out to our dentist. We knew we were going to have to reach out to our doctors, our general practitioners. And so that was our start, finding the representation of the 10 components, and quite honestly, finding people with spark, finding those people that are extremely passionate about what they are committed to. The next thing we had to do was get our feet wet. When we first started to form together, again, we did our storming, norming, conforming with one another as a team. But the first thing we did was actually go to our current policy. We pulled our health and wellness policy and we really dug down. We got the highlighters out. We gave it to every representative that we could think of, and we started to pick it apart. What we decided and what we recognized was that we had some areas within our current policy that perhaps we could do better with. Maybe we weren't following it to the highest level that we could be following. When we looked at areas, we decided that we had to know where to begin. And where we wanted to begin were 2 wins. Our 2 wins that we looked at were, we will not use food as a reward. We will not hold recess as a hostage. So as we looked at that, we decided, hey, there are 2 quick wins that we can get right there with our district without having to put much effort forward. We just need to follow what we're supposed to be doing. I said earlier that we started with our why. So when we started with our why, we went around the room. We went to every single person and we asked them, what is your why? So when we were sitting there with our medical professionals, when we were sitting there with our school nurses, when we sat there with our school social workers, we asked what their why was. And as we went around internally and externally with our community members and our internal members, they were pretty passionate about their why, what their why was. And their why was all about the students. Their why was making sure that we were approaching a wraparound service for our students, parents, staff members, community that would allow our kids to be the very best that they could be. So starting with that purpose, starting with that why was massive. So moving from the why, we went to the what. What is our task and what do we want to do? This became our vision. This became what we were going to be about. This was going to be what were we going to implement, what were we going to analyze, what were we going to refine, what were we going to enforce in our current and future wellness policies and practices, and how were we going to assess our current reality.
We also started to look at how we were going to do this. This is when we really started to dig into the meat of the WISC model. This is when we really started to look at assessing where we were, looking and having some deep discussions, and actually looking at a structure to allow us to not just say some things in these meetings or wish some things in these meetings, but actually to dig down to the bare bones to be able to figure out how we were going to fulfill all of these different things. All of the pieces and the silos began to come together whenever we looked at that model and the people and the humans that were sitting in that room that truly wanted to go for this exact same outcome, which was our student health and wellness. So how do you do that? So this became one of the most challenging pieces, and we actually took this from John OConnor, who actually starts to look at systems change within learning and academics. And we looked at his questions, and when you looked at his questions, it's point blank and you have to answer them. So as a group, you look at it individually first and you bring together your group response to the following questions. And we started off with these norms and current realities. In our very first meeting, as we sat around the table, we said, we know as a group, we agree, we must radically improve the health and well-being of all of our kids. We knew we had issues, we knew we had problems, we were ready to recognize those, we were ready to tackle them, but we have to do this, so how do we do it? What should we do? The second question we asked the entire group is, what does good health and well-being look like? That was big. When you talk about good health and well-being, we started to realize that we weren't all on the same page with what we believed that it was. So we had to actually norm what our expectations of good health and well-being were. The third one, we made a list of all specific health and wellness practices that are needed by the greatest number of all students to be successful. If the practices were implemented with fidelity for all students across our school pre-K to 12, then we would see great gains. And then we said to ourselves, what are those practices? What are those things? I know it's difficult to see this slide in detail, but I did want to show you the visual of what an actual agenda looked like, how we started off. This was actually one of our second agendas, and I know you can't read it, but as you're looking at it, it sets the goals, it sets the norms, it sets the 3 guiding questions, it sets the vision. It's something that we constantly come back to, and like I said earlier, we house all of our information in Google Classroom, so we can always go back and revisit a timeline of events and see where you started and where you end off. So as we're looking at that agenda-driven meeting, you can see that as we start through, we have very early morning meetings. So we start at 7 a.m. and we go until about 8 or 8:30 because the discussions, people just don't want to stop talking within these groups. With that, in this particular agenda, we had already determined from our 3 questions what exactly we were going to talk about. And because we asked those 3 guiding questions, we knew where we needed to start and how to develop the agenda for the next meeting. The visualization of this shows you that we talked about the ACEs study, adverse childhood exposures. We talked about our community of students. We talked about what our problems were. We talked about and provided scenarios of specific student needs that we had throughout our districts. We talked about what we were really facing. When we reviewed ACEs, we also talked about our youth risk behavior survey and what our students were telling us were some of the risky behaviors that they were starting to tap into. And when you look at that student data and you start to analyze what those kids are actually telling you, family life, environmental, community, it all starts to come together, and you're digging down and getting a little dirty with your kitchen table talk, and you're trying to actually visualize what you need to do to support these kids. So again, you're going to see our guiding questions. Those 3 guiding questions brought us to these 2 things. This is what our community told us. This is what our staff told us. They said, you have a problem in substance abuse. You have a problem with mental health wraparound services in home and within school. Those were the 2 hot areas that our community members, our doctors, our parents, our students actually sit on this. So with all of those questions being there, they said, you have a problem in these 2 areas, and this is what we want you to take the bull by the horns. We want you to start to solve these problems. We made a statement. We said, what are our resources for these students? And what we started with was, when approaching basically the needs of 15% of the population, because about 85% of our students' needs are going to be met with foundational support, or that core, that tier 1, that first level of support that you're going to put out there. We determined that about 85% of our kids were going to be pulled in through those supports. Our priority needed to be the 15% that we are not able to reach at this moment. And going back to that, Houston, we have a problem. It's telling us that our tier supports with tier 2 and tier 3, or our additional layers of supports, were not there, and what were we going to do about it? It's very powerful whenever a community member is telling you that they're there to support you with the substance abuse services and the mental behavioral health wraparound services, and then ask you to partner with them in efforts to support your students to move on to levels 2 and 3. We set the question back to the committee and we said, do you agree with these 2 given priorities? Is this in agreement? This is what you said per your feedback, but are we all in agreement? The 3rd question that we came to was, how do we move forward to address these priorities? We then started to move into our strategic planning. When we moved into our strategic planning, the only way that we knew how to do it was to actually break down the components. When we broke down the components, we spread it out across the room. We looked at the different tiers, the different levels, and the different components of WISC, and we decided that we would get into subcommittee groups based off of those components. So with that, we decided that everybody would pick their priority. They would pick their area of focus. They would pick what they were powerfully invested in, and then take their passion so that they could make that subcommittee the best that it could be. So how do we answer the call to improve the 2 areas? Our committee said we have to look at systems. We have to look at partnering with one another to be able to have something that we can move forward on and actually take actionable items on. We developed a strategic plan using the model that wraps around with the supports of the whole child. In the state of Missouri, the Department of Ed is really trying to support the WISC model, the approach, trying to support local districts in their endeavor. And so we went and started to seek out all of the resources that were available for the model. This is a quick example of our strategic plan. Again, I know it's small, but what I want you to notice is you can look far to the left and it says module. So we actually numbered each module, and even if it came out blank at the time because someone was not really sure what to put in as a priority goal, we left it in there. So again, during this work session, this work meeting, in creating a strategic plan, we had everything set up in front of the subcommittees. We had health education, and then we had it blank. And then they went in and plugged in some of the things that they thought as a subcommittee would work as priority goals. We added in the needs. What are our needs? And then we put in the elicited team members that were put in beside. With this, I will say that we used the School Health Index, which gave us great access to be able to look at what should be there, and it gives you a beautiful guide if you're not really sure where to start. It will give you that firm foundation of where you can begin as a district if you have people that just aren't comfortable with putting their foot out there. Again, this is simply a slide of an example of the actual creation of the strategic plan that we chose to do. As you can see, there's component 4, which is school health services, and then some additional items listed out to the side. Number 5, we knew we were going to have to tap heavily into the school counseling and psychological and social services because, again, as listed before, that substance abuse and mental health wraparound service was an area that the community and our internal staff members told us was a problem. So, strategic plan and action. We don't just believe in writing things down. We believe in actually taking action. We believe in moving forward daily, monthly, weekly, yearly. This is just a simple example, some pics that we have. So in the upper right-hand corner of this slide, we do home visits. We have half-day professional development, and on our half-day professional development, we rotate who does our home visits. Our nurses love doing home visits. They will jump in with the attendance liaison. They will jump in with physical education teachers. You'll see our director of safety is the one that's driving the vehicle there. Everyone gets in as a group, and we have strategically had plans of our home visits based off of what our need is at the time for those home visits. And usually they're very celebratory in nature. We are celebrating somebody's attendance and improvement. And it could even be something as simple as a student that had really low attendance percentage, but at this time we want to focus on the fact that they're back at school. They're doing better. They've made a % gain. So we're looking at very non-threatening home visits where we just come by and we drop off what we call Knights Notes. We're the Farmington Knights. So we're going to drop off some Knights Notes in recognition that we support you and we're very proud of what you're doing. You will also see there, grants that we've tapped into. The Missouri Department of Conservation. Basically, you can do tons of things with them and tap into students' needs and their areas of interest that sometimes our physical education and health classes don't offer within that regular curriculum setting. So you can see archery there. That brought in a whole new group into health and wellness of students that perhaps did not have an opportunity before to tap into things that they were maybe uncomfortable in doing. And then you will see to the far left, that's actually some of our clinicians, doctors, our OTs, our PTs, outside PTs and internal PTs and students that have attended our morning meetings. Another example that I wanted to share with you on how to execute your strategic plan. Again, you must live it. You must live it day to day, and you have to model it. We, like I said, we have monthly professional development. Every month, we have a half day that our Health and Human Services team gets together and we follow the WISC model and we utilize those modules to be able to figure out what our professional development need is at the time, and we provide that professional development. Again, through the PD, we'll tap in internally or externally based off of whatever need is where we're at. The next thing that we do is we actually have a culminating activity, a professional development day that is solely focused on health and wellness. We invite retired teachers, current teachers, classified, certified community members, all of the people that are on our health and wellness from outside and internal. And we put out wellness proposals. When we put out those wellness proposals, it's a mini conference. We have anywhere from 400 to 500 people attend this, what we call mini conference. And it's a whole day dedicated just to taking care of yourself. Self-awareness. It is a lot of physical activity that sometimes teachers don't get to do together. It's a lot of breakout sessions that you have to choose from. And this year we changed it up to where each of our breakout sessions were attached to that WISC model. That's when we bring in our screeners. We're able to do wellness checks with our staff. And then we're also able to provide that professional development on some of the areas that our students have said are a need, or our community has said it's a need. A lot of the functions this year were focusing on the substance abuse. It was also focusing on the mental and behavioral health needs of our students, among other areas. So in tapping into it, we have current proposals so you can step up and have leadership, community and external and internal participation, and then whole staff of 400 to 500 that attend this event. Those are a couple pictures of what we actually have within that day. So you'll see even one year we had puppies. So how do we communicate? How do we talk to one another about all of these things that we're doing? We actually have a newsletter, and each of our different areas taps in to that newsletter and provides any type of professional development or research or motivational portions that they believe they can bring to the table to talk to one another, to bring each other together. This is also a great way that our external members of our wellness committee is able to see and follow exactly what we're doing. And this is just simply an example of our Health and Human Services Outreach Team memo that we do, and we try to do those about once a month. Again, you'll see in the pictures, we have our physical education teacher tapping in with our librarians. Any place that we can make those connections with staff members, we try to do that. So again, if you've got a librarian that will get on board with you, the physical education teacher and the librarian partnered with the music teacher, and you can see we have the pedal bikes for students who want to sit and read and perhaps pedal at the same time. All of those areas just internally are things that we try to push within our district. So the last thing I wanted to tap into was where we are with COVID, where we are with the pandemic, and where we are with our WISC components utilization as guidance. So again, like I said in the very beginning, we are not perfect, and we are in our very initial stages of tapping into the use of the WISC model. There's so much more out there, and we continue to be learners. But what I found with the pandemic and with the crisis that we ran into as a district, we immediately and naturally began to tap into the WISC model as our structure. When we were making decisions, we knew that the top two areas, as you listen to ASCD and as you listen to CDC, they're going to partner and tell you that the two areas that we immediately hit were the physical environment needs as well as the social and emotional climate of the building. And even though you're not able to be in your buildings at the time, at least we weren't, we were able to tap in with one another on the social emotional piece, and we knew that that's where we needed to start. With that being said, our community and health and wellness committee members that we had already established relationships with became our leaders. We were able to immediately reach out to those community doctors and nurses and our community health agency and talk to those people about their recommendations. What were they thinking? Where were they at within the crisis? Again, the two main models that we practiced and followed under for our 9 weeks were the physical environment focus and the social emotional climate. As we determined and tried to balance the differences between moving on with the academic needs, we stuck true to the WISC model where it said you need to definitely follow those social emotional needs and those safety needs of students before you're moving on to those other areas of focus. We will continue every meeting we have in leadership with our task force with reopening. We know we're going to start back using and looking at the effects of what our physical environment are or what they're going to be. We're going to look at that first and foremost and then move into, again, how will we approach with reopening the social emotional needs of our students within the district? We know that that has to be first and foremost. We know that component of health is going to have to come in. We know we're going to have to talk about all of the areas of the expectations that, maybe kids weren't getting whenever they weren't in school for those 9 weeks or over the summer. So those components, again, we will split. We will go into our subcommittees, and those subcommittees will be the ones that will help us work with our emergency operations planning team to be able to facilitate the reopening and the reentry. What did that look like? So to close, probably a lot of what you expected. We did a lot of surveys, we did a lot of questioning, we did a lot of real feedback on what does it mean to be out of your physical environment? Is that scary? We did that with staff and we did that with students. We also did that with our community and our parents. We wanted to hear that feedback, even if it was feedback we didn't necessarily want to hear. We knew, again, that kitchen table talk time with that vulnerability, we had to have that. And we're utilizing those surveys, we're utilizing those that feedback from students and parents to be able to start. We were also able to do a lot of communicating with students through Google Meets and on the phone based off of their wellness surveys that we gave them to say, hey, here's your school social worker. And then the school social worker, based off of that survey that students received, you know, am I scared? Do I have someone that I can talk to? Are my basic needs being met at this time? They were able to get those answers to us, and then we were able to follow up with them. We even asked them, do you want an adult to check up on you? You know, do you feel like you have a connecting person that you can reach out to? And that's very telling. And that brings you to a point of being extremely vulnerable, of asking, you know, do you feel like you have a connecting adult within that physical environment? And right now we're not in the physical environment, but could we reach out to you? Those are just the starting areas that we began, and then we're sitting down to say, how currently does our health and wellness policy address what's happening right now? So we're going to go back and reframe some of our strategic planning based off of the new now and what we were doing currently.
So as a reminder, at this time, as a recap for both of our presenters today, we will hold the Q&A session and can go over any questions that you might have or going over any of the slides that we reviewed today. So you can submit your question in the Q&A box. You can ask any technical questions that you might have in the audience chat, and we will answer questions in the order that they were received. And so for our presenters today, you might see some of the questions that have been listed so far. So if there's any question that you are interested in answering, we have the first question and comment as well that's listed. So I'll just read this aloud, and if we want to just go through this. I work with special education students, the teachers, parents, and the local club continue to use non-nutritional snacks and lunches as a reward. I've had a very difficult time about talking with them and how that's not appropriate, and bringing this up constantly with them. As a nurse, this is very difficult as I research everything I suggest with minimal support. Are there any general comments from any speakers?
So this is Ashley. I will tap into that. So I'm a special educator, so I completely understand, you know, the token system and where I'm looking at, you know, you have to find that basic need, you know, that forced choice menu of what is the actual, you know, what is the student going to work towards, or what is going to be the desired effect, you know, the reward for the desired effect. With that being said, the one piece of advice I could probably give you is to build a relationship with those special educators and try to bring them in to some of those education pieces. Try to bring them in and say, is there a way possible for us to find some type of reward that perhaps is different from non-nutritional snacks? Because at the time, you know, I'm sure I probably did it as a teacher. And when you're quick thinking and that's an immediate reward and the child is giving you the desired, you know, results from it, it's really super hard sometimes to move away from that. So with that being said, the relationship building and the connections that you can make with them, and then just talk to them about the concerns. And again, I know that may not solve everything, but that's definitely my suggestion with it, is to pull them along and make them a part of the team.
So the next question that came in might be dealing with some of the present day examples that were shared and local school wellness policy, and it touches on how you might plan to use the WISC model with schools that might be virtual.
Yes, so currently, you know, it was strange doing everything virtual. It's obviously out of our comfort zone, and we were not trained to be great. I think I read somewhere we weren't necessarily doing any type of virtual teaching or virtual learning. What we were doing was pandemic learning and crisis learning. So we're going to have to unlearn some of those unhealthy habits that we formed during this 9 weeks, speaking for our district. But when we are looking at virtual use of the WISC model, that's whenever I was able to have Google Meets with all of the different component areas and bring everyone together to discuss and talk about redefining roles. Everyone had a different role. The counselors normally, you know, yes, they worked with crisis and they worked with some of the screening areas for, you know, the suicide intervention and prevention. However, you know, at this time we redefined their roles, and we did that virtually. We said we really want you to start to look at the academic portion support with students and let our social workers just take on the crisis interventions at this time. So again, a lot of Google Meets, a lot of documents that we shared, a lot of phone calls, a lot of just distant talks that we did, tons of surveys being sent to students, and more than anything, it was that foundational understanding that we're going to look at the safety and support of the child. Right now, if they don't have access and it's not equitable for them to have access, how are we going to get them their lessons? And again, meeting them where they are and knowing that you're going to have that continuum and nothing's ever going to be perfect. So when we realized to give ourselves grace and we were able to say, again, with things not being perfect, we went to that WISC model to look at what pieces do we currently have and what are we missing and how do we approach it. So again, through virtual, we still, you know, not done well, but we would reach out survey-wise.
In the beginning of the presentation, you had discussed the need for the work that you had been doing and how you really started. So a question had been asked, and it said, how do you ask people to be on the committee, or do they volunteer?
Okay, so I will tell you right now that we had some of our staff members, and they're truly, they are very introverted and they don't like to put themselves out there. So there were some that I knew were key players that would be quiet leaders, and I did go seek them out. I did go seek certain people that I knew could be that spark, but they were very internal about how they did their work. Others, we actually just put it out there, and that's how it grew. We started off slow. We started off with maybe 30. And again, trying to meet the models and trying to make sure that we had great representation from what our community was, because we wanted to ask our community, what do you think about us and what are the needs? And to do that, you have to have that representation. So again, some reaching out in the very beginning to pick those spark pieces, but then after that, people will start to come to you, and that's the culture you want to create. You want to create a culture where everybody wants to be on this committee, working and moving to wrap around the whole child and do wonderful things, and they will. They will start to see some of the things that you're doing, and it takes about 6 months to a year for it to even get out that you're teaming on this. But after that gets out and you promote it through, you know, social media or whatnot, you will have people come to you for different needs that you've never even thought about, and there'll be great partnerships within your team.
There's another question, and it might be a great one for both speakers, so I'll just share this. Is there any advice on going to my small local school district in creating a more cohesive wellness policy and implementation of WISC model?
This is Caitlin, and I can start off, and then hopefully Ashley can add on too. You know, it can be overwhelming to look at that big WISC model and think I have to do everything. So I would say start slow and consider using the School Health Index or similar assessment tool to see what's currently happening in schools in your district. That'll give you a sense of, you know, where there are strengths and where there are opportunities to make changes. And then just start slow. Maybe pick 1 or 2 goals for the year. Okay, this year we really want to emphasize I'm just throwing it out there, the physical environment component based on our assessment of what's already happening. We want to improve that area. What are some steps we can take? And just build on that progress over time. I would not suggest trying to do the whole thing in 1 year. It's just there's not enough time to do that, and people have so many other things that they are working on. So I would say start small, start with something that, you know, seems to rise to the top as a priority where there is some energy and passion around addressing it.
I completely agree with Caitlin. So, and that's what we did. If you notice in the very beginning, even though they were very large problems, which was a substance abuse problem and behavioral health need, that's where we started. And our 2 quick wins on that, we recognized as a group, and that's the power of that committee. That power of that committee was able to look at everybody and say, hey, wait a second, Ashley Krause, you're telling me that when we analyze this, you really don't dig down and dirty into health education until, you know, they have a course in 5th or 6th grade, and what are you saying? You know, of course we have a substance abuse problem. Where's the education? Do we have any type of substance abuse supports or interventions or you know, discussions about that? And we knew at that time we needed to reach out to, you know, agencies, and we got a free grant. We got a grant for a curriculum. You know, we're utilizing Too Good products, which is Too Good for drugs, Too Good, you know, for bullying. They have all of those wraparound pieces at a really great cost. And with that being said, it was a quick win, just looking at what we just didn't have at the time to do that. The other one was, you know, making sure that we were constantly communicating and providing professional development to our staff members on that behavioral health piece. Those were the 2 areas we started on and worked on for an entire year before we even opened up to look at the others. That's my comment towards that. Great answer, Caitlin.
I think we have time for about 1 more question before we go into the next resources and closing information to meet our time. There's a question that says, you have great engagement among a wide range of school and community stakeholders. Is it challenging to recruit and have them contribute? And were any members paid for their service?
No, we don't pay anybody. So it is not difficult. Again, we have a town of about 20,000. A lot of these people are parents. A lot of our doctors know the problems that we have. They are great partners with our schools. We have good relationships with our agencies. So it really wasn't difficult to get them there. And I thought, wow, the only time I'm going to be able to get the doctors here are if I have a meeting at 7 a.m. And I thought no one's going to show. So it is super scary that first time you put yourself out there to try to bring people together, and you're so scared that only your internal staff members are going to show up. But again, if you explain yourself and the purpose, and that there's, I think once people see there are actually going to be actions and outcomes that support students and are going to wrap around the whole child, it's just a fun place to be, and everyone wants to talk. And the reason they want to talk is because you set that kitchen table for vulnerability, and you say point blank, we're going to have some difficult conversations, and we're not going to agree on everything as we move forward. But the rule in here is that we respect one another, and as we have our differing opinions, we come to a common consensus that is all about our kids.
Ashley and Caitlin, thank you so much for running through these questions with us. And we know that this dialogue has opened up so many more ideas and questions that everyone in the audience might have. And if there are any other ideas or questions, of course, please send an email to education@sophie.org if you are interested in connecting with our presenters today. That would be an opportunity to answer any other questions that you might have, and we could go from there to continue this discussion that we are having today. But we do want to share some additional resources and information that would connect to the topic that we are talking about. And we have a school health page that is found on sophie.org. Here you can access contemporary resources, tools, and information, as well as training resources on current and emerging topics for health educators and other leaders in health. SOPHIE has a 10-part WISC team training modules with a set of instructions that allow states, districts, and schools build, strengthen, and sustain school teams implementing the WISC model. So since we're talking about the WISC model on today's webinar, this is a really great tool and opportunity for individuals interested in professional development and putting together their own professional development plan that we released this year, as well as many other tools on this page. You'll see an SEL, or Social Emotional Learning and School Health Guide, a series of 3 WISC fact sheets, SOPHIE journal and open access information, as well as the school health playlist where you'll find the recording today. The information on this slide was supported by SOPHIE School Health Project, which is a cooperative agreement with the CDC School Health Branch. For additional information and to learn more about CDC Healthy Schools, please visit the website. You can also sign up for SOPHIE School Health Updates on sophie.org and find upcoming SOPHIE webinar information by visiting the calendar. If you have any other questions, of course, please email education@sophie.org. And on behalf of SOPHIE, thank you again to our presenters today and to all of our participants. If you have any other questions or if you want to connect, we would love to continue the conversation. And please take a moment to complete the brief feedback form that will pop up in your internet browser following today's webinar. The recording will be available within 2 weeks, again, available on SOPHIE School Health playlist. Thank you. This ends our session today.